Hey there! Ever heard of PELIOSIS hepatis? No? Well, you're not alone. It's one of those mysterious conditions that rarely gets talked about. But don't worry. Today I'm going to break it down in a way that's easy to understand. First off, what exactly is PELIOSIS hepatis? Imagine tiny blood-filled bubbles forming in your liver. Sounds weird, right? That's essentially what happens with this rare liver disease. It usually flies under the radar and is often discovered by accident during other medical tests. Now let's talk about diagnosis. How do doctors figure out you have this condition? They start with blood tests to check how your liver's doing. Then they might use imaging tests like ultrasounds, CT scans, or MRIs. If these tests suggest PELIOSIS hepatis, a liver biopsy might be performed. A small tissue sample from your liver is examined under a microscope. So, what are the signs and symptoms? Many people don't even notice they have it. But if symptoms do show up, they can include abdominal pain, especially in the upper right quadrant, jaundice, and signs of portal hypertension, which is increased pressure in the liver's blood vessels. Now, let's move on to epidemiology. PELIOSIS hepatis is rare, but seems to be showing up more often, possibly due to better diagnostic tools and increased awareness among doctors. It's more common in adults and can be linked to certain medications, infections like tuberculosis and HIV, and some blood disorders. People who've had organ transplants, especially kidney transplants, are more at risk. And there's even some evidence suggesting a genetic component. What about the incidence rate and male to female ratio? Since it's super rare, exact numbers are hard to pin down. But studies suggest it's slightly more common in men than women. And finally, survival. The outlook depends on what's causing the condition and its severity. If it's related to a medication, just stopping or changing the medication might be enough. For cases due to infections or other underlying causes, treating those issues is crucial. In severe situations, surgery may be necessary to handle complications like bleeding or liver damage. So, there you have it. PELIOSIS hepatis may be rare, but understanding it is the first step in managing it effectively. If you found this video helpful, make sure to like, comment, and subscribe for more health insights. Stay curious and stay healthy.